And you did get tested, at least antibody tested first, and then ultimately diagnostic tests, and both initially turned up negative, correct?
Correct.
But luckily, Dr. Verone, who we've had on this show a number of times, said, you know what? Something's fishy here. Let me take a look. And he took a chest x-ray. What did he find?
Yeah, so he actually did a CT scan and he immediately called me. I was waiting in my car, waiting for the results, and he immediately called me and said, "We're going to admit you, it's pretty extensive, it looks pretty bad." And I was just shocked. I mean, I was like, I don't feel that horrible. And he just kept saying, like, your CT looks way worse than you do. And I was just blown away. I mean, I was really surprised.
What did he say would have happened to you had you not had that CT scan and been admitted?
I mean, he told me worst case scenario, it's possible I could have required intubation if I would have waited a couple days more, which is so crazy to hear as an ICU nurse.
Your breathing. You did have some issues with breathing. Tell me what that was like.
So, laying down, I didn't have to take so much deep breaths, but whenever I would get up and kind of walk around and require to, take deeper breaths, I would just have to cough. Like, I couldn't walk around and do everything I needed to do throughout the day just without coughing and taking deep breaths. And I would get a sharp pain in one area, and that's where they said it's mainly localized in my lungs.
So here's the thing, and again, you brought this up at the beginning. You're 24.
Mm-hmm.
You're in a hospital bed right now. I thought this
I
wasn't
know.
supposed to happen to 24-year-olds. What have you learned?
I mean, it's crazy. I feel like, as a younger person, and everyone thinks, we're invincible, and I'm, fairly healthy person, and you just never think it's going to happen to you. And you just have to take all the precautions, everybody, no matter how young, old you are. It's so important.
Across the country, reality setting in.
This is the problem. There is no roadmap, no plan for the country.
The U.S. now averaging more than 60,000 new cases a day. 20 states starting the week with their highest 7-day average. Reopening is paused or in reverse in more than half of all states. Philadelphia just canceled all large events through the end of February 2021. And South Florida continues to break records.
Miami's now the epicenter of the pandemic. What we were seeing in Wuhan 6 months ago, 5 months ago, now we are there.
The positivity rate in Miami-Dade County, which accounts for nearly a quarter of the state's cases, is almost 30%. Nearly 200 employees at Jackson Health, the area's largest hospital system, are out sick with COVID-19.
People aren't respecting this virus, especially younger people.
California setting new records for hospitalizations and ICU admissions, with the majority coming from Los Angeles County. In Harris County, Texas, home to Houston, hospitals are approaching surge capacity. Officials there urging the governor to let them bring back a stay-at-home order.
The longer we keep this going, pretending like these incrementalist restrictions are going to fix the problem, the longer it's going to take to recover.
Testing and a significant lag in getting those results, still an issue months into the pandemic.
If you swab and then you get the results back in 7 days, that's not ideal, and particularly if you have symptoms.
40% of infected cases are asymptomatic, according to the CDC. Yet the country's testing czar is encouraging some Americans to hold off.
In places like Arizona and Texas, if you wake up in the morning and just feel like you want to test, you might not need to do that, right? We need to think about those who are at high risk or in high-risk situations.
Schools a flashpoint as the administration insists in-person learning must be the standard, though without offering a strategy.
The countries that have managed to safely reopen schools, they've done so with declining infection rates, not rising infection rates.
Well, I mean,
and they've been on-demand testing available. California has neither of those.
San Diego, Los Angeles, and Atlanta announcing plans to begin the year online, as new polling from Axios and Ipsos shows most parents say it would be risky to send their kids back in the fall. CDC Director Robert Redfield is optimistic.
I actually think a majority of counties would meet the criteria, provided that the teachers have the confidence to reopen, the administrators have the confidence to reopen, and the parents.